Regenerative stem cell therapy is a growing alternative to surgery. Here to tell us why is Dr. Lox, and joining him is a familiar face to Daytime, Beckles. Ian is a former member of the Tampa Bay Buccaneers, and he played 9 seasons in the NFL in the trenches and as an offensive lineman. So now he is one of Dr. Lox's patients. Gentlemen, welcome to Daytime. Dr. Lox, I want to start with you. Is it different when you're treating athletes?
Yes, it is in some ways.
And how?
They usually have more significant trauma. We have lots of patients who are weekend warriors and they have long histories, but athletes tend to accumulate more significant trauma, and if they've had surgery, it impacts it. So there are individual nuances, but even patients who are older, it's still the same diet and exercise that we talk about. So.
I imagine after 9 seasons in the NFL, you had some trauma.
Had a little bit of trauma.
So why'd you see Dr. Lox? Why'd you go see him?
Well, I mean, I was playing football since I was 7 years old, so the wear and tear on a lot of parts of my body, was pretty evident. But my knees was to a point where it was really interrupting my everyday life, and I couldn't work out like I wanted to. And heard about Dr. Lox, went to him about 6 years ago, and now my knees are the best part of my body. I mean,
really?
I worked out some young kids the other day, and they were amazed at the way I was bending, and I'm 51 years old, so it's all because of Dr. Lox, yeah.
So it's all about the stem cells, but there's confusion about stem cells. There's embryonic, amniotic, and your own stem cells. So can you clarify any of this for us? What are you using?
Well, I'm using the patient's own stem cells, and there are certain rules in the United States. If you're going to really call it stem cells, it has to be the patient's own cells the same day. Outside of the same day, it becomes a drug, and it's not FDA approved as a drug using the patient's cells. There are just a lot of political reasons that have to do with pharmaceutical companies, and the whole medical healthcare system is part of it.
And there are a lot of doctors out there who say they are stem cell experts.
Correct.
Not true?
There are people who are saying a lot of things, and a lot of it is misinformation or lack of understanding of it. I've been doing this since nearly the very beginning with some of the few people in the country that were doing it, and I lecture nationally and internationally, so I really understand the science very well.
And Ian, can you take us through what the procedure was like? What did they do?
It's really not that bad. He looks for a part of your body that has some fat, which wasn't hard for me. He found it on my love handles and, extract it a little bit, and then he injects it into your knee. The whole procedure is less than an hour. And, I was teaching spin classes back then. I got my procedure on Friday. I think I was teaching a spin class the next Wednesday.
Wow. And
then a week after that, my knees were great.
Is that the usual type of people seeing that kind of change that quickly? Or is he unusual?
He's a good unusual. No, everybody's different, and I like to say there are patients who listen to me and those who don't, and that affects the outcome as well.
Right.
And there are certain factors that make people better candidates, and then you choose how you do the procedure based on each patient. So there's a lot of nuances to it.
Well, I'm glad it worked for you, and it worked for you as well.
Yes, it did.
I know this is exciting news for a lot of people. For more information, you can visit drlox.com. Dr. Lox and Ian Beckles, thank you both very much for joining us today. Daytime will be right back.